Hello, everybody. This is Michael back with another episode of the Intrusive Thoughts Show. Today I'm going to be looking at a CBS kind of news clip that I saw today that was about someone who was unable to get I think it was a coil. I think she had some complications because of not being able to get certain resources in our healthcare system, and I thought we would discuss that today. So let me get that pulled up for everybody. Okay. Can I make this big screen? There we go. So it's about 6 minutes, so I'll probably just put that on, and then we'll kind of go from there.
Investigation underway for the past year and a half. We have really troubling new details about a new mom's death and our ongoing look at how private equity investors have siphoned hundreds of millions of dollars from community hospitals. In the state of Massachusetts, state officials and healthcare workers say that one company's efforts to squeeze out profits left their healthcare system reeling. Chief Medical Correspondent Dr. John LaPook is here with this story. It's a big one. John, good morning.
Good morning, Tony. 9 Massachusetts hospitals owned by Steward Healthcare are under intense scrutiny as the company faces a financial crisis. They include Boston's St. Elizabeth's Medical Center, where Sanjita Rashid suffered complications after giving birth to her daughter last October.
Sanjita Rashid's smile could light up a room. That's what her husband Nabil Huq told us from his parents' home in Bangladesh.
The laugh was, contagious, and you could hear it from a different apartment even. But that's something I really liked about it.
With a baby girl on the way, Sanjita, a statistics professor, and Nabil, a postdoc student at Boston University, chose to deliver at Boston's St. Elizabeth's Medical Center. The hospital is one of dozens across the U.S. acquired over the past 15 years, with backing from private equity investors, by a company called Steward Healthcare.
Do you remember Sanjita's reaction when she first saw the baby?
She was crying. It was a beautiful moment, I wasn't expecting it to be this blissful.
That bliss was short-lived. Sanjita experienced cascading complications, first bleeding from her uterus, then discomfort in a different part of her body.
She felt pain and she couldn't sit.
And would it be in like the back flank, like where the ribs are, kind of?
Exactly.
Doctors sent Sanjita for an emergency CAT scan, then rushed her to the operating room.
And what did they find there?
That the liver was bleeding.
Doctors told Nabil they wanted to use what's called an embolization coil to stop the bleeding in Sanjita's liver. He says when St. Elizabeth's didn't have the coil, she was transferred to a second hospital.
And then an hour later, she had another cardiac arrest, and they couldn't revive her. It was shocking, I said,
terrible.
What exactly happened?
It's awful.
What exactly happened, including why she died, is now the subject of a state investigation.
As it should
St.
be,
Elizabeth's
honestly.
own medical staff filed this complaint with the state's health department, saying the manufacturer repossessed the coil weeks before because Stewart hadn't paid its bills. In a lawsuit, the manufacturer alleged Stewart owed nearly $2.5 million.
Is outrageous. It's unacceptable.
Why outrage?
Because the supplies weren't available that could have saved her life.
Nurse Kathy Reardon is an official with the union that represents healthcare workers at Steward's 9 Massachusetts hospitals.
They bought these hospitals to serve the underserved, and that's not happening.
Last year, our CBS News investigation found a trail of unpaid bills at Steward hospitals around the country, leading to a shortage of potentially life-saving supplies. At this now shuttered San Antonio hospital, nurse Jessica Carrasco told us there was a shortage of tubing for respiratory masks.
Coordinators were having to phone a friend to let us borrow, a cup of sugar.
In December, Steward announced it was closing one of its Massachusetts hospitals, setting off statewide fears. In a statement, the company blamed its financial woes on the pandemic and lower reimbursement rates from Medicare and Medicaid patients.
Do you buy that explanation?
I think that's hogwash.
Massachusetts Governor Maura Healey says Steward executives have driven the company deep into debt and enriched themselves at the public's expense.
The game was come to Massachusetts, make some investments, and then begin to suck out as much as you can in terms of profits.
Steward's initial investments included propping up the employee pension fund. But financial records show that since 2016, the company has sold off more than $1 billion of its hospital's real estate And in early 2021, Steward's owners paid themselves millions in dividends. Around the same time, Steward CEO Ralph De La Torre acquired this 190-foot yacht. Its price tag, an estimated $40 million. He declined an interview.
They've taken money away from these assets, which are so important, hospitals that provide needed care, and they're using that money to line their own pockets. I'm disgusted. It's selfish. It's greed.
Healy told us she's placed state monitors inside Steward's hospitals to try to ensure patient safety.
And we have to do that because Steward has failed.
It's just still surreal that she's not here.
Nabil, who first learned the coil was repossessed from a Boston Globe reporter, says he's trying to focus on the small milestones in his daughter's life instead of wondering whether Sanjita would still be here if the couple didn't deliver at a Steward hospital.
Is that part of the problem? You'll never know. You'll never know whether having a coil would have saved her life or not.
Right. This is not how it should be.
In a statement to CBS News, Steward Healthcare said it's receiving a cash infusion that, among other things, will, quote, address vendor obligations. The company also said privacy law prevented it from commenting on Sanjita's death and said its executives always put patients first. Governor Healy told us, quote, the sooner Steward is out of our state, the better.
Wow.
You're right, John. They will
laws.
never know, but the fact is that the coil, she would have had a better chance. We do know that, that's for sure.
Well, we don't know, and that's one of the things that's so tough for Nabil to live with. Would it have made a difference? Wouldn't have made a difference? There are a lot of things we don't know. The transparency here is not very good. I mean, there's an investigation.
The contrast of not...
All right, so I think you kind of get the gist of it. Here, let me get my full webcam out. It is just awful and disgusting that this company can't pay its own bills, but apparently can go and buy yachts and all this, and they don't have to suffer any consequences. And what's this cash infusion they're getting? What, is this like another bailout or something? Because I swear to God, these people going to be asking for a bailout, and they don't deserve it. These people running, this private equity running healthcare systems is becoming a problem, actually. It's actually, it's something that's been a big problem for a while, and it's getting a lot worse. I believe in obviously having a free market, but also a fair market, and also one that, and especially in the case of healthcare, is actually serving patients and actually, doing what's in their best interest, as that is what, doctors sign on to do, basically, is, to do no harm. And these people have done disgusting amounts of harm. The fact that they wouldn't pay their own bills and are allowed to just give out dividends like that, first of all, they should have been required to be paying all their bills before they even touch those dividends. I don't know how they were able to do that. That honestly should be illegal. No, it is unconscionable, honestly. And I guess I kind of wanted to just talk about this, in general, of private equity getting involved, because it's showing that National Study of Quality of Care in Hospitals acquired by private equity shows worsening of fall and infection risk, other measures of quality and safety. Some post-procedure adverse events increased even though private equity hospitals performed fewer procedures. So even performing fewer procedures at these hospitals, they're still getting worse outcomes and at a higher percentage. The new findings amplify existing economic concerns about the growth of this for-profit ownership model. Yeah, it's very concerning. And I believe private equity's increasing role in the U.S. healthcare, with approximately $1 trillion invested in the past decade. And I feel like the pandemic really made this worse too, because, we spent trillions of dollars basically just doling out money, and these healthcare companies, these private equity firms, I'm pretty dang sure probably got some of the money from some of this that they didn't really use towards patients whatsoever. There's just no transparency, first of all. But this is what really struck me. So when health systems buy hospitals, they generally do not use borrowed money. Do not use borrowed money. But private equity, they only use a small amount of cash, and they can use a lot of debt to buy these hospitals. This right here, that needs regulation. That has to change. You have to have the cash, or you're not getting a hospital anymore. Um, or they need to have a lot more cash on hand to be able to be purchasing these hospitals. I'm shocked that that's not even a requirement, actually, that they're able to do it with that much debt. Um, I'm surprised there isn't some stricter, loaning requirements. I know during the 2008 financial crisis, that was something we did, in the housing sector, and that clearly needs to be happening here in the healthcare sector of among these private equity type of firms buying out these hospitals because clearly, they don't want to pay their own bills and they want to squeeze profits at the expense of you, the patient. Um, you know, this isn't a very Republican or Democrat type of issue. I know people like to frame it as that, but it needs to be discussed because our healthcare system is having a lot of issues. We have a system that doesn't incentivize better outcomes whatsoever. It incentivizes just keep going through the revolving door system, basically, honestly, to just keep coming back and paying these people thousands of dollars, and not really addressing the root causes of, what's causing these type of healthcare issues. I know there's been talking about in another AHIP, which I believe, is a healthcare group, I believe. So another thing I found interesting is 45% of all healthcare mergers were involved with private equity. So they're definitely, I would just say overall, private equity and healthcare, like it's not a good mix. Like it's a really concerning mix. And what concerns me is that the pandemic really probably accelerated these type of mergers because you got big companies probably getting all these billions of dollars, these pharmaceutical companies, all these healthcare companies, that don't have your interest at heart. It wasn't going to the doctors and directly to really getting those supplies and resources. There was just I know there were just during the pandemic. I mean, there was those PPP loans alone were like fraudulent. I remember reading about all these Congress people had one employee and saying they had companies and getting loans from them. It was crazy what they were able to get away with. Um, and like it's mind-boggling that people are literally dying for profits. It's evil, it's grotesque, it's all types of wrong, evil, honestly. Cuz it's really like so like our healthcare system, I'm for a competitive system still, don't get me wrong. But that type of competitive system needs guardrails for sure. It needs the loaning requirements is the biggest one for me. These private equities buying it with all this debt is insane to me. Because it's a hospital we're talking about here. There should be stricter. It should be not that easy to buy a hospital first of all, as a firm whatsoever. Like the requirements to buy a hospital should be the probably the strictest in this country, to be honest with you. It should be the hardest type of real estate to even get a hold of, in my opinion. Because this is what happens when you make it too easy to do. This is what happens. People literally die. And it's going to keep happening. When you have 45% of all healthcare mergers and acquisitions being done by private equity and, $1 trillion over the past decade, and that number's probably going up, it's concerning. It's just the reason I felt the need to discuss this is because it's been an ongoing political topic, obviously, of how to best manage our healthcare system. People wanting universal healthcare, which and even that has mixed. I would say mixed because there's a lot of mix of even what it means to have universal healthcare per se. Um, Even among countries that have those, there's a lot of differences. Per se, pretty much. I think with the U.S. healthcare system, I actually made a list here of kind of just random things. But before I do that, I also want to look at the Singapore system. I learned about the Singapore system actually in school when I was getting my marketing degree. It was in one of my economics classes, actually. It was very interesting to learn about. Um, and they call their Singapore's healthcare financing system is underpinned, so it's Singapore, out in Asia. So they have a very interesting type of. I would say they have a mixed system, and I think it's a very applicable system. I think the United States could adopt because I feel like it has the elements that I think a lot of people on both parties would like. I think it's been shown. I know they're a smaller country, so obviously there'd probably have to still be some differences, but just the general concept. MedShield Life, a universal basic health care insurance, is mandatory for citizens and permanent residents. Oh, let me pull up the. Sorry, let me get the display up here. I'm sorry. It's like I'm reading off nothing. Okay, so universal basic healthcare insurance mandatory provides lifelong protection against large hospital bills and select costly outpatient treatments. So they definitely had some previous one it said that had issues. I don't know what they would have in this if we had some form of this. I know we have Medicare and Medicaid already, kind of, which I think is kind of more what their Meta Fund, which is the government safety net for needy Singaporeans. That's more Medicaid, probably. I know we kind of got Medicare already, but MediSave is what really interests me. Is a national medical savings schemes helps cover out-of-pocket payments. Personal and employee salary contributions, 8 to 10.5% on age 2 MediSave accounts are mandatory for all working citizens and permanent residents. These tax-exempt, interest-bearing, currently 4 to 5% accounts can be used to pay for families members' healthcare expenses. So this is the part right here because we already have types, these types of like HSA kind of cards that exist and these type of health savings accounts. I think maybe what we could maybe have is like have these private firms that have these type of savings accounts, but then again have those type of more tax exempt, type of things. Maybe there's some type of national kind of backed plans, kind of would be a good. This right here, I think, is the best thing ever that their system's doing. Medical savings like that, some type of contribution type of framework, because then you have your money ready to go. Whether even if it's just for a checkup, you have that money ready to go. Um, their Ministry of Health, their role of government, is to promote good health and reduce illness, ensure access to good and affordable care. So they have a good mission. They actually, they obviously, they work with planning to determine the number of care professionals. I know I also read, so there's the MOH Holdings, a holding company for public healthcare institutions that also handles infrastructure development and coordination of manpower and talent. So again, there's obviously a lot of information about it. It's only 4% of their GDP. For our country, it's something ridiculous. I don't even remember what it was, but we are paying a lot on our GDP with healthcare. So that's a good number, 4.47. That is share of public expenditure increased 32 to 41% due to increased public subsidies, reduced out-of-pocket costs. And then they also, like I said, I want to go back to kind of where it said, yeah, the government relies on competition and market forces to improve service and raise efficiency, but intervenes directly when the market fails to keep healthcare costs down. So this is a very hybrid type of system that I like. I like that it still allows for competition. I think that is still a very important component that other healthcare systems don't have, and they really, I think, that they're working on the training. I think is a very big thing. They really invest in making sure that they actually have doctors. I think it's probably one of the biggest investments our government should be making because, especially when we have an aging population with the boomers being the largest generation right now, that's going to be something that's going to be critical. I think, we need to be doing more to invest in that type of tuition type of honestly just give their I mean you can't give all their tuition free maybe, but definitely a good chunk of it at least. I think the government needs to I don't want to say subsidize, but in some instances maybe they need to. I would rather go there than these foreign wars, let's put it that way. If we took all the money we sent to all these foreign wars in like Iraq and stuff, I mean you'd be able to cover medical students debt probably forever honestly, and you'd be able to get rid of all of it. I know people don't want to get rid of our debt, and I think there's other issues I know with our college system that have these endowment funds and have all types of issues with it, and that there's not enough kind of competition type of thing. Um, So they also have the Agency for Care Effectiveness, where's National Health Technology Assessment Agency, which provides guidance on cost-effective drugs and treatments. So then there's the Health Sciences Authority, which regulates manufacture, import, supply, yada yada yada, to meet appropriate standards. Basically, that kind of sounds like the FDA, I would say, somewhat. They're kind of equivalent. Now, this is interesting. The Health Promotion Board, responsible for promoting healthy living in Singapore. The board formulates health policies, implements health promotion and disease prevention programs, like those for school and workplace health, and works with industry partners for healthier food products. We really need that in this country too. The amount of chemicals they be putting in these foods, and I like these foods; they taste good, but I think targeting some of that's definitely going to be necessary. Going forward. Um, so another thing that really we should be talking about with that story with that woman dying and not being able to get the resources is the COVID-19 pandemic. We kind of got to go back to that because we failed miserably and we are not prepared for some other type of disease outbreak that could be deadlier, honestly. No one trusts the government anymore. They got it wrong. They didn't allow doctors to do their own policies and try different medications that they thought might have worked. It was such a top-down approach that didn't allow adaptation. Um, we really, I think, failed that because we centralized too much, I think, a little bit with our response. Even though we left it up to states and stuff, I still feel like individual hospitals could have handled it better. I think like letting doctors see, what type of drugs might work. I feel like they shot down some other ones so quickly, and I feel like we could have found some really effective solutions, especially for a respiratory virus. Like those are common. Like I feel like there's a decent amount of treatments for that. Um, so, and I also, like I said, they have an industry, a role in their government that just encourages you to, work out, eat healthier, those type of things. Um, those are the type of things we need over here. The obesity rate in this country is astronomical. The amount of heart and issues, all those type of things is insane. I know the what was it? The average age people be living to has gone down dramatically. Average life expectancy has gone down like a whole year, I think, since COVID happened. Like that's crazy to me. I've never, it's been, it's like one of the first times it's even gone down, first of all, which is crazy because it's been going up, basically for the past century, with medical advances and, technology and stuff like that. So I think it's crazy that that has gone down. I guess overall the things that I kind of I wrote it down. I know it's kind of corny, but I just feel like it listed things out in a better how to prevent more issues with private equity buying up hospitals. Like I said, stricter loan and debt requirements, absolutely. It should be the hardest type of asset to buy as a hospital in this country, period. Period. You should not be able to get it that easily. There needs to be, yeah, like 2008 style transparency requirements is kind of what I put. So we kind of need healthcare Dodd-Frank, I think, in a way. Another thing I'm going to mention, since they couldn't pay their bills and that company took, yeah, hospital supplies cannot be used as collateral whatsoever. You come up with some other way. You sell an asset. You sell your $40 million yacht. There also needs to be dividend, I think, limitations as well. Again, just more transparency is just overall what we need in our healthcare system. I know we've made some significant strides. Both Trump and Biden have really pushed on the prescription drugs in particular, which is one of the biggest components to healthcare. Um, I didn't list it here, but I know administrative costs, just general, like the billing systems definitely needs an overhaul, those type of things. We need to make it easier to do billing overall. I think we need one system for all these different systems, similar due dates and stuff like that would help. Insurance across state lines, health insurance, those type of things. Um, Patient outcome audits, we really need to be vigorously looking at that now after that happened. That is, I mean, she said she's putting state monitors. She's a Democrat governor, by the way. So, like I said, I know this is difficult for people, and I know there's been a lot of jostling on healthcare between the Democrats and the Republicans, and we're getting nowhere with it, and it's becoming worse and worse. They'd rather not do it. It's gonna take both sides to really even get at these reforms that they're looking for. I really think the Singapore model is applicable in this country with health savings accounts in particular. I think is one of the best things they do, and it's something we need to do probably in some capacity. Um, I think that's one of just and they have stricter pricing transparency. I don't know if I really read that, but they have to I remember researching it. They had to have postings of how much things would actually cost and stuff, which was very interesting. So, just those type of kind of things, it's not rocket science. It's not going to be easy either though. It's going to take a lot of work to really make a system that works for people, that really treats people's illnesses and really seeks better outcomes for patients. But there is an issue though to be said that, when there's financial incentives, when there's pay per service type of incentives, no one's going to want to solve healthcare problems. They're not going to want to cure cancer tomorrow or diabetes or whatever. They want you to keep, like I said in the beginning earlier, it's a revolving door system. They want you to keep coming back and coming back and coming back and coming back and coming back till you die, basically. Draining you of every penny you have. It's a problem. It's really a problem. And private equity is making it even worse because private equity, I mean, it's like I said, it's always existed, and there's always been hospital systems, but it was never like this. I never got the vibe that I never saw something like this happening in a first world country like ours, where they would deny someone life-saving medical treatment because greedy corporate people decided they don't want to pay their bills and would rather take 40 millions in stock dividends and buy a luxury yacht. These people should be in jail for murder, honestly. This is involuntary manslaughter, in my opinion. It's completely unacceptable what these people have done with our healthcare system, honestly. And the big pharma and the food companies, and they're all in the back pocket of every politician, not looking at your best interest. You also have the military industrial complex that would love to send your sons and daughters off to war if they had the chance, if it meant making a profit. We have a death for profit system right now, and that's a problem. Um, Generally speaking, that's not capitalism, that's not liberty, that's something grotesque. That's a form of oppression, honestly. Um, so it was funny because I wasn't even sure what I was going to talk about for this intrusive thoughts episode, but I saw that and it struck me because it's unimaginable that a kid would lose their mother over that. Just I hope that person. I mean, I know they're suing that hospital. I would sue that hospital personally myself, honestly, and I hope that father maybe considers that because that was their election of duty, honestly. Um, I would even say this company failed its basic fiduciary duty as well, which is also a problem. That alone should be enough to really clamp down on them, shut them down. To be honest with you, because I know a little bit about contract law, a tiny bit from my business background. And that is something you can actually sue for breach of contract on is failing your financial obligations to fulfill your fiduciary duty, not doing that due diligence is a big thing they can get you on if you're not careful. Um, so I really wanted to discuss this today because I think it's an important topic. No one's talking about it right now in the current political landscape. I'm kind of disappointed I'm disappointed on both sides of the aisle on this because both of them have not come together to make a good healthcare system, and that's what's required. That's going to be required to reform it and make meaningful change. those type of things to really get more people to have insurance and be able to get the health care that they need it's going to take a lot of work. It's not going to be something that can be done overnight. It's going to take a lot of reforms, but I think the biggest reform we need to make right now is those private equity firm requirements with loans. And like I said, it should not be that easy to get a hospital. You should have to have the most vigorous, you should have to have the best credit score known to man to be able to buy one. You should have to be able to show that you got actual cash on hand, a good chunk of cash in hand. If you have a little debt, fine, but it should not be as much as what these private equity firms are using. Typical hospital systems, like it said in that article, actually have to have the cash on hand to buy it, and private equity honestly should have to too, in some capacity, honestly. Um, just that alone, I think, is the biggest reform we need to make right now with private equity getting involved in hospitals, because if it continues, it is going to destroy our healthcare system and destroy people's lives and kill people. Literally kill people. Like more than any war ever fought before. Not to mention all the doctors and nurses shortages I've been hearing about too. These people don't want to work in these hospitals anymore because they're also not getting paid what they should be in a lot of cases. I've heard horror stories of these nurses being worked long hours and whatnot. It's insane to me that our system is not really like this is the one of the biggest functions of government, in my opinion, is to provide for basic health care. It doesn't have to be everything, but when it comes to emergency services and not dying, I do think the government has some type of obligation in some capacity to work with people to make sure that their citizens aren't dying. And it seems like our politicians don't care about our lives whatsoever. It seems that they would see us as cannon fodder to go against Russia or whoever they perceive as an enemy, and would warmonger and not make peace whatsoever and airstrike people galore, citizens, by the way. Um, so those type of things. So I guess I'm gonna switch kind of focus now. I could talk about the Trump decision with the New York Appeals Court. They're saying that he's probably still going to have to pay, I think, in one of the lawsuits against him. I want to talk about this civil trial. I know you've probably seen enough about it, and honestly, I know it probably gives you a headache, and I don't blame you for that. All the cases against Trump aren't the same. I think we need to start there. They're not all equal. I think there's a tendency to make them all seem equal, and they're not. I think the suing over Trump saying he committed fraud, I don't think he did, first of all, because the bank even defended him, and I even have the article right here, and several other articles that showed that the bank did defend him and said, "We would love to do business with Trump. There, we did our own." There was in the documents that he had that said that there, to do your own diligence and looking at the valuation of your property. You know, it was Alpha Bank, I think, or who was the one they were working with? Yeah, they said that they are willing to do business. Yeah, Deutsche Bank, that's who it was. That they were willing, there wasn't any issues with it. That they were, throughout the trial, Trump attorneys bought witnesses, including former Deutsche Bank top executives who testified the banks sought additional business from Trump, whom they viewed as a whale of a client because he had money. Um, saying that he committed fraud. There's no victim in that crime as the problem. This Letitia James suit to me is probably the most frivolous of them all because, first of all, you're going to have estimations that aren't going to be entirely accurate. Um, you know, an accounting professor at New York University even said, found no evidence of fraud, that at best they maybe wrote it was simply an error, which happens. Um, we're not, he said, my main finding is there are no evidence whatsoever of any accounting fraud, Bartov testified. Trump's financial statements, he said, were not materially misstated. That means not purposely misleading. So I think this case, Trump's appealing it right now. I don't know what his biggest argument could just be the Eighth Amendment, that it's cruel and unusual punishment. Um, I believe there was actually a case, and I don't remember where I read this, so I'd have to double check, but there was a case where they even said that even states could be held to the that states can't do cruel and unusual punishment, that they're held to the Eighth Amendment as well. I think it was actually Ruth Bader Ginsburg who actually made a majority opinion on that, I believe. Um, so I think on those grounds, Trump has a very strong legal standing. I don't think even if there was a misstatement that $400 million is even close to what that should be. Um, you know, they've waited so long. They had years to do this. I don't know why they're doing it now. Well, some people do, but I'll let y'all figure that out. No, they've had years to bring this after Trump. They could have done it. They could have done it in his previous two runs if they wanted to, and they didn't. So it really does give politically motivated, and like I said, cruel and unusual punishment. So I don't know. That was just a little article I saw. I guess the final thing, kind of to wrap up, is the Michigan primary results. I voted yesterday. First of all, I didn't even know there was a primary. First of all, like I almost forgot. I heard nothing about it. Actually, and actually the turnout was one of the lowest in recent history. And I think that even though Trump, yes, he won big on Haley, 68%. And we can even look at the Democrat primary, with this uncommitted being 13.2%. And Marianne actually came back to the race after that. She's seeing that. I think she sees that there is still a demand for there to be someone else but Biden. And this one's so far showing that Trump has a strong lead. Um, I think both candidates are still going to have to do a lot of work here, really trying to appeal to voters. Trump seems to be doing a lot better than Biden in a lot of ways, in some ways. I mean, I know Biden did better in the primary, but when you have that 13% right here, I mean, that's like. Oh, my headphones shut off. Hold on. Did I fix that? Oh my god, my headphone. Oh, I'm just gonna keep going. So this 13.2%, which I believe this where oh, sorry. All right, so yeah, this 13.2% uncommitted is significant. I know people are very mad at Biden's policy on Gaza in particular. It's become a real political I know in one of my other videos I covered how I think the Muslim population of Michigan voted for him like 80%. And they're like 200,000 voters approximately. And that was approximately Joe Biden's overall margin in the state. So if these people don't show up for Biden, Trump wins. Or they're going to go to some other candidate or whatever. It's a big problem. I did hear that he's trying to possibly get a ceasefire in Gaza. I kind of predicted that he would try to get one. I did it in my 2024 predictions video. I think the pressure's really starting to mount on that issue for him. Um, it's a surprising cudgel to me to his career for some reason, but I think one of the biggest reasons is just because there's this big Muslim population in this country. I know there's people who have been long critical of our war, kind of our Middle East policy for a long time, and I think this just really stressed that criticism that people had. Um, I actually think Republicans are missing an opportunity with this to appeal to Muslim voters. Yet they really could, make a strong case. Muslim voters have some very conservative views. Probably more conservative than even some people in our party, to be honest with you. Um, and I think we do have an opportunity. I think Trump's biggest thing, because he doesn't want to alienate anyone, all right? So he wants to make a peace deal. I think he needs to stress that this stuff didn't happen under him. I think is his biggest thing that he's going to really try to hammer home. I think that's something you'll be seeing a lot more of is this stuff didn't happen under me is going to be one of his biggest messages on this issue. I know he's talked about that with Russia being able to solve it in 24 hours, and honestly, I believe him because you know why? Um, there was the Minsk II agreements in Russia, and I know I did a video talking about that in one of my other videos. How a lot of these we kind of reneged on a lot of these agreements, and that's what Putin talked about. I know with Tucker. I don't always agree with Putin, and I think Putin did some very awful things, killed people, killed political opposition. I know Alexei Navalny. I wanted to originally blamed Putin for, but apparently he died of health issues, allegedly. Um, so, I can't make him this bad wolf guy either. I think we could maybe. I really still believe to this day that the Ukraine war 100% could have been prevented if we did not build the Nord Stream 2 pipeline with Germany, because then that just gave Russia leverage. And Trump was the only person who understood that, I feel like. He won't say the word leverage, but that's very much his mindset. He always understood leverage, and he saw that Russia getting that would kind of give them this motivation because now they got money coming in. They got funding. We're literally paying them. And then they were probably able to build up their military in a lot of ways. So, I think in that regard, I think Trump really needs to stress his record, say that I didn't have wars and I'm going to continue to prevent them. I do think he needs to lay out more specifics on that a little bit. I will say he's been a bit vague at times. I won't lie about that. I think that's something he could stress. I think Biden, if he wants to even have a chance of winning, he needs to do something similar. He needs to stress that I'm going to resolve this war in Gaza right now, that we're going to get it done before the general even starts. He's gonna really want to try to get somewhere better on some of those conflicts. So the next thing we're gonna talk about. So Trump has like I think 100 delegates right now. Oh, my ad blocker. I just need to pause this on all. Wait, let me pause it on all. I just need to get rid of ad blocker. Everyone doesn't let me have it anymore. I know I probably should delete it honestly, so I can support my businesses. But so first of all, with Michigan, with the Republican primary, there's actually this follow-up caucus that they're having. And the reason was because they had to move the whole schedule kind of around to because Joe Biden sucks so bad he couldn't make Iowa and New Hampshire first for some reason. So the remaining 39 delegates are going to be up mainly to party leaders, congressional leaders, that type of thing. Um, I'm predicting they're all going to go to Trump on like if not most of them are going to go to Trump. I think this Republican Party in our state's very Trumpian, almost too Trumpian. I know there's big beef going on between Peter Hoekstra and Carissa Caramo, I think it is, about who's even in charge. She's saying her ouster was done improperly and some. She was a whack job. I'm not gonna lie. She was the worst performing candidate in this past election cycle. Um, how we ever voted her over Matt DePerno any day, I still don't understand. He was the Attorney General candidate. Why didn't we pick him? Even Tudor Dixon would have been a better choice. Literally anybody. I don't know how she got in ever. She was a nut job. She just was all over the place, pushing all this type of stuff. I mean, and I think, there's voting irregularities and whatnot, but I mean, she was just crazy a little bit, and she just didn't have the appeal to anybody. And there's a reason why she didn't perform as well, and she performed the worst out of all three candidates. So I just don't know why we picked her. I don't even see what qualifications she had exactly to even be leading the Michigan GOP, which is a disaster, by the way, right now. And that alone could help Biden win the state, maybe, if we don't get it together. Um, so yeah, they're having that caucus. I'm predicting a big Trump landslide. He probably going to get close to 39, possibly all of them, if not most of them, in the 30s for sure. Idaho, he's going to sweep. Missouri, probably going. I say Missouri. I meant to say Missouri. I don't know why I said it like that. So yeah, we have this on March 2nd and March 3rd, March 4th. So we have a slew of them coming up actually. We have Super Tuesday where we have 874 delegates at stake. The only state that Nikki Haley even comes close in is probably the District of Columbia just because she does appeal to more liberal leaning voters. That is probably a state. I don't know if she'd win it. She might win it all the way, honestly. It would not surprise me. The DC swamp loves her over Trump any day. That's the only state I could ever see her winning whatsoever. Or not state, but district. Only area I see her even winning or coming close in. I see Trump sweeping a good chunk of these. North Dakota. I just see him sweeping a lot of these areas just because they're smaller populations, a lot of rural areas, and those are areas he tends to do better in. I even see him doing good in Alabama, Alaska, Arkansas. California, he'll win. It might be a little closer, like I said, based on just the liberal leanings. Maybe some of the suburbs go to Haley a little bit more. She does have a higher appeal to some of the higher education levels, so that's very much one she could gain some on. Colorado, probably going Trump. Iowa, we don't have to worry about. That's for the Democrats because that's, like I said, they moved it. Maine, well, Maine, they try to remove Trump off the ballot. I would low key not be surprised if he does pretty good there because of that. Maybe she picks up a couple. Probably Massachusetts, Minnesota. Um, Probably he wins. Maybe she probably still gets a couple delegates here, a good chunk. Um, so like I said, probably after this day, Trump's pretty much the primary's pretty much over after that at that point. Because I mean, the only like weightier states that Haley would maybe even stand a chance in would be like Illinois right here at 64 delegates. But you have the 12th, you have some of these states, but they're not very weighty states compared to those. You got New York. I actually think Trump would do good there because he actually won that state last time, and he just has a strong ties to that area. Puerto Rico, probably. Pennsylvania might be closer in some areas, but like I said, Trump's gonna do pretty good, I think, overall. I think he's gonna be able to get at least 80% of these is the lowest amount he gets. He probably gets more than that in some of these states, especially the really red states, I feel like are really gonna favor him. So that's kind of where I see the primary going. Trump's probably gonna win it. I think Nikki Haley won't drop out till like right after these ones. Maybe yeah, she might even be stubborn enough to stay after these ones. Yeah, she's gonna stay after the 19th because then I feel like Louisiana and like the rest of these, like she's not gonna care. It's gonna be over by then. Maybe she just stays it. There is an argument for her on her behalf to stay in longer. She thinks that Trump's going to go to jail still, and there is still a very big possibility that he does, and that the whole thing gets upended, and those type of things. And it does build her political clout a lot for the next election cycle, and I think that's kind of what she's doing at this point. Um, Staying in the race, kind of. And she's got enough money to burn through to make it to the 19th here. Maybe even stay until the 20. Like I said, this is really where I could see her dropping out is after these ones. Because after that, I mean, what we got these 9 delegate ones. I mean, you do have the 19th. I mean, like I said, New York's kind of a weightier, so maybe she does wait till a little bit after April. Like maybe she goes after like some of the like after April for sure. April is like when it really dies down. After the second is like you got nothing going on over here. I mean, not a lot of big delegate states um going on after that. So Trump probably they're predicting he's going to win it in March. He can win pretty big here. But like I said, he needs 1,000 something. I think he's at 100 right now. Yeah, he's at 110 delegates. It's right here. So he wins 800. He's at like 1,010, and I believe he needs 1,215 to win. So he'd only have to do a couple more days to really get that full number needed, and then it's bye bye Nikki Haley onto the general. Joe Biden's already at 206. He needs that much to win. He's pretty much already secured it. I mean, he only got the fact that they got the two uncommitted, which apparently happened to Obama in 2012, which is kind of interesting. But I mean, he still went on to win the election, so I don't know how big the uncommitted vote will be. I don't know if that was. I feel like that was a uniquely Michigan thing in a lot of ways, just because of the Gaza and the strong ties it has to the Muslim community. So I don't know how well that's going to translate to the rest of the country in terms of uncommitted. I don't see it translating that much. I see it maybe in a couple areas, but not as strong as it would have been in Michigan. I think Michigan would really be the only place that even came close to happening. So, like I said, it's gonna be a good Trump sweep in the Super Tuesdays, and he actually might do a lot better in those states than he did in the past other races. Um, he did really good in Michigan. It's been one of his best performing states so far. And that was just based on the polls I saw, so I kind of knew that because he had strong ties to the working class and things like that, and I just think that was an area he did better at. Anyway, y'all, I know I covered a lot today, and I actually did this all in one take, which is amazing. I normally run out of breath and have to like breathe, so yeah, we need better health care. That's the primary. The Trump trial, we covered all that today. Anyways, like and subscribe, hit that like button, hit that notification bell, and do all those lovely things to support me. I would like to keep doing a YouTube channel on the side, and those type of things, and kind of just keep making content. It's a lot of fun. I really enjoy it. And yeah, thank you so much. Have a wonderful rest of your day.